I'm Dr. Susan Horvath. I'm an obstetrician gynecologist. In medical school, we have a third year where we do rotations through hospitals and figure out what specialty we want to do. And I got to my obstetrics rotation. And one day one of the labor and delivery nurses asked me to step in and help her in a room. And luckily she was very experienced, but there was a patient there ready to have a baby. And she talked me through the delivery, and I was holding this baby and looking at it and thinking, wow, this is pretty amazing. And then I heard in the background someone sniffling. And I looked up, and it was the father who was filming the delivery, and he's just crying. And I just realized, I started crying, and I realized this baby's pretty amazing and unique, and I got to be part of this family's life. Brief, but it felt so nice, it felt so good that I could be a part of their lives for this very special moment. The field of obstetrics and gynecology is a very happy field. Our patients are admitted to the hospital for good things. They're not coming in sick, and generally it's a very special time for a patient, and I feel very, very privileged to be able to be part of it. And for me, it's all about the patient experience, and I think that I have that privilege to be a part of the patient's life, and I feel like it's my responsibility for my patient to look back on their prenatal care, look back on their delivery, and have good positive feelings.